Hey everyone, it's Dr. Rick, founder of Verbal411.com, and I wanted to talk to you about what to do with inflammation. So inflammation can be in several different forms. It can be in the form of, say, a tooth abscess or shoulder pain because you did too much work, or if you're doing hiking, which I'm preparing for Mount Rainier with a small group in about 3 weeks. All of us are increasing training intervals and distance, and sometimes as you increase the amount of demand that you put on your muscles, you can also have something called overuse. Overuse doesn't necessarily mean you tore an MCL or an ACL or a meniscus, but it can mean that you do develop some swelling. It can mean that kneecaps don't like what you're doing to them as far as mileage, so they'll get inflamed. And whenever a joint or muscle gets inflamed, it reacts by, number one, tearing if it's muscle, tearing the small muscle fibrils that's made of actin and myosin. And usually guys will know that that feeling is kind of good. It's called SWOLE, SWOLLE, I believe. But listen, it's just an acronym for swelling. And being swole in the gym is something that bodybuilders always look forward to. But when you're older, I'm 63 this month. When you're older, you can easily overuse or spill over from balanced exercise and sleep and activity and sedentary life into an inflammation state. And when that happens, well, you can recover. If you're healthy, you recover fast. If you have rheumatoid arthritis, you recover really slow. If you break something or tear something like a hip joint or a muscle in the leg called a hamstring or a quad or an Achilles, once you tear, if it's a complete tear, that's a big problem. And we try to avoid that by slowly ramping up into activities. That means over the course of a year, the older you are, the slower you should go. But even if you're 60, 70, or 80, you still have to do some resistance exercise. I don't care what you hear in the community, resistance exercise maintains muscle mass. And when you maintain muscle mass, you become independent. And again, it helps you prevent the injuries that are coming, especially when you add in balance exercises, flexibility, or hand-eye coordination. It's just ultimately very important no matter what age. So the idea that I wanted to discuss with you is I did a video somewhere in the distant past on the use of turmeric. Turmeric is a root, and the data out of, I think Janet Funk did F-U-N-K. Janet Funk did a study on turmeric use in rheumatoid arthritis sufferers and found very good results with increased range of motion. And I believe she also found decreased inflammatory markers in the bloodstream. So we try as much as possible to use natural therapies, to also use exercise, maybe acupuncture, icing if necessary. But it's important to know what to go to before going to your doctor's office. There are over-the-counter medicines like Advil, ibuprofen, Motrin, Naproxen, Aleve, and topicals like Voltaren or ibuprofen, but they do have side effects, believe it or not. It used to be anybody could use anti-inflammatories, but about 10 years ago, they found a direct correlation between anti-inflammatory use and kidney damage and heart attack. So I don't want to get into the mechanics of how that happens, but just realize this: if you do have kidney problems, you shouldn't be on an anti-inflammatory. You should be asking your doctor first. If you have heart problems or high blood pressure, that too has to be careful. You have to be careful with. And I'll take the next step. If you have had bypass or stents put in, and you are on a blood thinner, you definitely can't be taking anti-inflammatories. Even the topical ones you have to be careful with. But bottom line is that you can use this, and this is turmeric. I did a video about Doctor's Best high absorption curcumin. I'll put a link down below. I even did the video with turmeric powder because I have a lot of patients that are Indian, and they always say they're taking turmeric. But the doses that you have to take in powder form are gigantic, bushels worth of turmeric root. It's easier to just take the concentrated amount. It's just a pill, honestly. So Gaia brand was approved by Consumer Labs. My old go-to, Doctor's Best high absorption curcumin, that was also approved by Consumer Lab. And I think Consumer Lab does a pretty good third-party assessment of a lot of over-the-counters. And the active ingredient in turmeric is curcumin. So there are some supplements that just advertise curcumin, but this one says turmeric. And if you look at the back, they do have proprietary formulations. You probably can't see that, but it's okay. And just for the sake of ease, I suggest taking turmeric or curcumin 3 times a day, sometimes 4 times a day, especially if it has black, here, it has black powder in it. I'll go really close. You might be able to see that. The black powder, according to the work of Janet Funk, helped the active ingredient, the curcuminoids, get into and through the small intestine. So if you take turmeric by itself, then it bathes the small intestine, but the absorption through the wall of the small intestine is hampered. When you have black pepper in addition, then it accelerates the absorption. So, and I have people who take the powder and then they say, oh, I'm going to eat black powder or black pepper with it. Nobody knows, or at least the companies, you hope that they give a pretty decent ratio. Now, in this one, the black pepper is superficial CO2 extract, 7 milligrams. Now, I'll just show you this again. That is where it is, 7 milligrams. And so the balance between the black pepper to absorb and the turmeric amount per capsule hopefully is good enough. And I take it 3 times a day, sometimes 4 times a day. I've used it for my trigger points. I have fibromyalgia trigger points. I also have chronic back pain because I do a lot of deadlifting or powerlifting to avoid the osteoporosis that's coming in my life. And then again, with this hiking, I have to find the right blend of shoes, and I use these. These are Altras. Altras have a wide foot plate or a wide toe box to allow for splaying of the toes. You really have to splay the toes out before taking off. The gait, not to go off track, but the gait of a foot is supposed to be heel rock and then splay, heel rock and then splay. And the farther the toes are splayed, the more push you have of the metatarsals to push off. And when splayed properly, the metatarsal area, the frontal foot, can tolerate 7 times your body weight. If the toes are together and you push off, it's just imbalanced. And you'll have foot pain or plantar fasciitis or metatarsalgia. Bottom line is that I use it as often as every day. And I do think it adds to decreasing overall inflammation in addition to topical. You can use whatever topical you like. I like Panaway, and I've done a video on that as well. Panaway is an essential oil, has helichrysum in it. My go-to is whether I do a marathon or my 5Ks, or I'll bring it with me to the hike at Mount Rainier that I'm doing. But I think it's important to understand how inflammation works, how if you let it ramp up, it will make you immobile, and how if you alter your activities, I don't say just get bed rest, but if you decrease your activities, even in the gym, take it down by 30%, work on flexibility and stretching the muscle around the irritated area, I think it's important. Now, you always have to have a physical therapist help you and guide you as far as what you should be doing when you're injured, and how to get back. And then one thing I don't like is that when I have, say, osteoporotic women and men that go to their physical therapist after having a hip replacement, the physical therapist's plan is to usually replace them or put them back to where they were right before the fracture. And I say, don't do that. Go better than that, more advanced. Obviously, the activities of that person got them into the fracture, so you want anybody that's seeing physical therapy to get to where they were and then accelerate even better than that. So I ask my physical therapist to design exercise routines before they graduate patients, not only to take care of the injury, to prevent the next injury, whether it's the same injury or some other consequential problem. So hopefully this gives you an idea about how to use turmeric properly. If you're one of my patients, not only do I use turmeric, I also use compounded anti-inflammatories to use through the skin. My blend doesn't have an anti-inflammatory. It has micro doses of muscle relaxers. I think I have them put menthol in it in addition to a few other anti-inflammatory herbs, and it works great for me. But I can always have you adjust it or make the formula different. It's proprietary, but I don't have a problem with showing you what's in it, and you can ask Wakanda Compounding for that. Don't forget the use of ice. In Chinese medicine, ice is not allowed, but I'd say icing an area should be, especially before you get into your doctor, before you get into the immediate care center, or before you get into me, ice every hour for about 10 minutes. If you ice longer than that, then it changes around the blood vessels. You want the blood vessels to decrease for the acute injury. when you leave ice on for 10 minutes, it decreases, but after 10 minutes, 15 minutes, the blood vessels start to open up. And you don't really want that. You want it to be controlled. The amount has to be controlled. And if you control the blood flow, you control the inflammation post-injury. So hopefully this gives you a couple ideas. If you have your go-to anti-inflammatory that you got from consumer lab approval, then put them in the comment section down below. If you've used acupuncture or your own modalities, let me know. I've also done videos on a TENS unit, and that works great too, and cryotherapy, which I'll all link in the comments section. So thanks for watching. Don't forget to subscribe or give a thumbs up if you liked it. I'll be doing further videos on my journey to Mount Rainier with my group. Hopefully you stay healthy. Thanks for watching.